Hi, thank you for viewing this whistle-stop tour of delivering online counselling, the good, the not so good, and the good enough. Now, my name's Dr. Judith Roberts. I am a member of staff at Bangor University as a lecturer, but I'm also a clinical psychologist and so have first-hand experience of delivering therapy online. And of course, these are strange times. And despite forms of remote counselling existing for many years, in these unprecedented times, the mental health workforce has had to adapt quickly to the ever-changing landscape brought about by COVID-19. There are many benefits to delivering online counselling, such as delivering mental health support to those who may not be able to engage with face-to-face counselling, or due to organisational financial considerations and possible waiting lists. To some extent, therefore, this provision has its benefits. That said, there are some considerations that need to be thought about when engaging in this method of mental health support, and the aim of this brief presentation is to highlight these difficulties or challenges so that we can offer an online counselling experience that is good enough, or to put it another way, to make the best of the current situation and to ensure that those with mental health needs are able to access the support that they require. Now, as I've said, online or remote methods of counselling have been around for some time, as illustrated by this quote by Malin and Vogel in 2005. So any delivery of mental or behavioural health services, including but not limited to therapy, consultation, psychoeducation by a licensed practitioner to a client in a non-face-to-face setting through distance communication technologies such as the telephone, asynchronous email, synchronous chat, and video conference. Okay, so this shows that there are many ways of reaching out to clients or service users that offer alternative solutions at times where face-to-face contact is limited or not possible. The focus, however, of this presentation is on online means of therapeutic delivery through video software. Now, the primary issue facing counsellors and mental health professionals can be practical in nature. Which mode or software which facilitates delivery do we use? Of course, some of these considerations are out of our hands, given that many of us will be guided by our organisation, who may stipulate certain software that is supported by that organisation. Whichever method used, though, should offer an adequate, secure space so that we meet our professional obligations and the therapeutic aims of our clients. This is not simply a case of clicking on a link and hoping for the best, and many of you may have already experienced the challenges of online communication, having already engaged in some online meetings or some FaceTime with your family and so forth. The key message here is to test the software by practicing with colleagues or maybe friends. This allows you the opportunity to see what it's like to use the software, how easy it is to connect maybe, and whether your internet connection is sufficient. Hopefully this provision is supported by your organisation and you have the equipment you need. We also have to consider the equipment that the client has. You know, it's all very well the counsellor having the required devices, but a client who relies on poor internet connection or who does not have the necessary equipment or device may suffer as a result. At the very least, it is hoped that the client has a smartphone with sufficient capability for video contact. These considerations are incredibly important for establishing the therapeutic relationship, or at the very least, giving that therapeutic relationship the best chance of developing. When arranging an initial counselling appointment, a phone call where these facts can be established may be the best option, and alternatives discussed if this is necessary. Other practical factors to consider include the home setting. In the current situation, it's highly likely that the client, and possibly the counsellor, has a home situation where securing a private space is difficult. Again, this requires planning prior to engaging in online therapeutic work. There needs to be an establishment of boundaries where the online session can be conducted at the most private time for the client. In this respect, such an issue can be overcome by highlighting this issue. As we've all discovered, I'm sure some of the issues with online meetings or counselling present themselves during sessions. And of course, sometimes this cannot be avoided, but thinking and planning ahead can ensure the best outcomes for all concerned. One solution might be the use of headphones, which can not only help with hearing the counsellor's voice, but can also induce the feeling of privacy. Of equal importance is the comfort of the client in the space they occupy. In a typical therapeutic setting, you may have a neutral, quiet space with unobtrusive furnishings and neutral surroundings. Now at home, they may be facing a pile of washing or chaotic surroundings that can influence their ability to attend to the session. Such distractions are over and above those posed by family members and pets, but should receive the same consideration. Now, this same issue can be true for the counsellor also. It's also important to discuss with the client what might happen if the session is interrupted should the technology fail. Would you attempt to reconnect, or maybe connect by telephone? Agree with and inform the client what happens in cases of missed session time as well. Make sure that you've planned all these things out at the very beginning so that if problems occur, you and the client know what's going to happen. Even with the correct technological device and internet connection, there are other factors that require thought and appropriate planning. The client may have developmental or emotional needs that make online counselling difficult. If the client has a particularly complex mental health issue, the reliance on characteristics such as tone of voice, facial expressions, body language, eye contact, and even silences in a face-to-face setting may differ when conducting online video therapy. These factors which aid communication may lead to misunderstandings and can occur because of camera positioning, size of screen, distance from the screen, and clarity of the screen. All these things contribute to these potential issues. For some clients, online counselling may not be feasible. For example, if a client has suicidal ideation, a great deal of risk, or paranoia. These factors should be carefully considered with a multidisciplinary team or in supervision, as such issues should not automatically exclude clients that need support. If there's a mild learning disability or the individual is a young adult, online counselling could be supplemented by text-based cues such as emoticons, the use of capital letters in text, as indicative of non-verbal language. The key to determining these issues may simply be guided by a practice session, which may involve a mini tutorial of how to engage with online counselling and how to supplement the video facility. As already mentioned, if there are issues with there being appropriate hardware or availability of software, then in situations where the need for counselling support outweighs the impact of delaying such counselling, interim telephone support may be of benefit. One of the main concerns regarding online counselling is the adequate formation of a therapeutic alliance. Despite there being clear differences in face-to-face versus online approaches, it does not necessarily mean that one is better than the other. There might even be some benefits. In a review conducted by Simpson and Reed in 2014, exploring the use of video conferencing to deliver therapy in Australia, they found that delivering therapy by video could facilitate the development of a therapeutic alliance in the same way as in a face-to-face setting. Now, therapists have to work really hard to convey empathy via video, and this is crucial in developing that therapeutic alliance. You know, things might happen such as the screen freezing or a lack of eye contact due to camera placement. And of course, there's no box of tissues to share with the clients when they become upset. Verbal methods of conveying empathy tend to result in better therapeutic outcomes via video. Other benefits of online counselling is the slowing down of interactions, where the need for turn-taking and paying more attention to social cues is necessary. Research evidence also shows us that for some clients, online counselling felt less intimidating and less pressured. Clients tend to report that they feel less self-conscious, less shameful, and value the opportunity for control when using technology. What Simpson and Reed have shown across 23 studies exploring therapeutic alliance and online counselling is that therapeutic alliance is achievable even where there are technological difficulties with the internet, image or sound. Crucially, therapists tend to check in more with the clients and check in with their understanding. And there's certainly a benefit in being able to view your own image so that you can see how you're conveyed to the clients. It's a great opportunity to see how you present to other people. So the nature of informed consent is to truly explain facts about engaging in therapeutic work that the client should be aware of. Delivering therapy online poses its own unique challenges, and these factors should be communicated to the client. Primarily, the client needs to be informed about the advantages and disadvantages of online counselling. Examples might include advantages such as not having to travel to the counsellor location and having the comfort of home, a space which can be shared with the counsellor at hand. Disadvantages may be the lack of privacy or the blurring of boundaries when the client can see the counsellor in their own home, or equally that the counsellor can see the home of the client, and that might feel invasive. It's recommended that the counsellor talks with the client to establish what they feel are the advantages and disadvantages, so that the counsellor has a better understanding of the client's view and can therefore make any necessary adjustments or adaptations in collaboration with the client. It's also important to consider barriers in assessing the client's capacity to consent. Literacy levels, cognitive capacity, and if the client is under the influence of alcohol and drugs, may be more challenging to identify in an online environment. Therefore, information conveyed about online counselling and what it entails should be clear, and the counsellor should keep an eye out for any indication that the client is having difficulty with their understanding. If the online counselling is a continuation of an earlier face-to-face therapeutic relationship, it's important to note the changes in consent and confidentiality and to note this in the client records. Changes to how information is stored may need to be discussed, as this will be different, and of course you have the facility to record the sessions. The client should give consent for any recording to take place, but equally boundaries need to be established where the client wishes to record the session with the counsellor. Now, you should carry out a risk assessment in the same way that you would if you were having face-to-face sessions, and highlight the actions that you would take in such situations, such as contacting the GP with concerns. Additional considerations might be establishing where the client is during the session. Are they at home? Are they at a friend's house? And what would you do if the client terminated the session suddenly following a disclosure that they may harm themselves or be at risk in some way? Setting up a new or amended safety plan would be appropriate in this instance, so that the client and of course the counsellor knows what the process will be in these instances and what would be most helpful to them. There can also be sharing of information about external support partners. The security of the video link should also be discussed, particularly as part of the informed consent process. Email or telephone contact should be covered, and areas of concern might be if the email could be read by others in the household or if telephone conversations could be overheard. Typically with video contact, it is assumed that consent is indicated by the engagement in the online session. However, it is important to establish whether there are organisational or professional body requirements for written consent. Such issues can be discussed with your organisation or professional body. I hope you found this brief presentation interesting and useful, particularly if you are engaging in online therapy via video for the first time. Although different to face-to-face therapeutic methods, there is evidence to show that online counselling can be just as effective if consideration is given to the different skills that such an approach draws upon. Ultimately, if online practices can supplement the more traditional methods of counselling, and indeed those would otherwise, or help those who would otherwise be unable to engage with mental health support, then it is a valuable addition to any counsellor's toolkit. So it's been a pleasure sharing this information with you, and if you need or would like to talk about this in any more depth, do get in touch. I've listed some digital resources and the references I've used for this presentation in this slide. And hopefully we will get through this, and hopefully we'll get through this with a whole new set of skills. So thank you and goodbye.